to turn health into a bridge for peace and to work for well-being. Today, the Andean Health Organization Hipólito Unanue Agreement, Orasconu, has an important history of unity and constant work with the ministries of health of all 6 Andean countries and the partner organizations in favor of materializing the right to health. In this technological globalization era, the COVID-19 pandemic reasserted the relevance of the healthcare sector for a life with well-being. That's why today it becomes a priority to keep health at the core of all the policies and social awareness. And we need to unite to advance and to progress towards a society with care of life. Health is the bridge for integration and peace. Reflections like this, you can find them in Boletín Notisalunas Andinas, a monthly edition that we would like to invite you to read, and it's available on the website of Orasconu and also on the knowledge mural of Andean integration. We would like to invite you to drop your name, the organization that you work for, and your country in the chat box of Facebook Live or YouTube Live. In that very same space, you can also write your questions or you can email them to the email webinar.orasconu@gmail.com. In order to have access to your certificate of attendance, as it is usual, in either chat, Facebook Live or YouTube Live, you will find a link where you will need to click and fill out a brief survey and leave your information like email address. Please make sure your email address is correctly written so that we can send the certificate there. This will be emailed in the upcoming days. In this webinar, we will continue doing the usual dynamics. First, we will begin with the institutional official greeting. Then we're going to have the keynote speeches, and then we're going to have a dialogue based on the questions that the attendees ask in the different platforms. We would like to invite you to please write your questions and comments or send them over email. To begin this important webinar, I would like to give the floor to Dr. María del Carmen Calle Dávila, Executive Secretary of Orasconu, who is going to welcome and give the official greeting. Dr. Calle, you have the floor. Thank you very much, Berta. Good morning, good afternoon, good evening, wherever you may be. Orasconu was created and founded by decision of the Ministries of Health of Bolivia, Chile, Colombia, Ecuador, Peru, and Venezuela in December 1971. Since May 2020, we have been conducting webinars weekly in order to promote the interactive learning continuously and constantly.
Cordial bienvenida al webinar número 227, que tiene el propósito de destacar.
I would like to welcome you to webinar 227 that has as a purpose to highlight that every single person has the right to a clean, healthy, and sustainable environment.
Además, es necesario para gozar de otros derechos humanos, a la vida.
This is also necessary to enjoy other human rights like life, health, food, potable water, among others. And this is mentioned on Resolution 76/300/2022 of the General Assembly of the Nations. Plastics are environmental contaminants that are detrimental and noxious. According to the United Nations Program for the Environment, almost 1 million plastic bottles are bought per minute, and up to 5 billion plastic bags per year are used around the world, and half of the plastics that are manufactured are designed to be single-use. Scientists have warned that we have exceeded the limits that we have on Earth for chemicals, plastics, and the weather. Nature right now is in danger, and it's urgent to do something in order to deal with these problems and issues. And that's why in this webinar, we have an objective, which is to inform about the relevance, pertinence, urgency, and negotiations of a global treaty to eliminate the contamination, the Global Plastics Treaty. I have to also say that at Orasconu, along with the ministries of health of the 6 Andean countries, we develop plans, projects, and actions that are aimed at the environmental health. For instance, the Andean Health Committee for the Risk Management of Disasters and Climate Change, and also the Health Without Damage Committee, we foster and we try for all the health establishments to measure their carbon footprint. On the Orasconu website, you can find a publication called Significant Experiences in Sustainable and Resilient Health Establishments. Also, we conduct congresses, training sessions, fora, webinars, experience exchanges, among other initiatives towards this aim. I would like to welcome warmly our keynote speeches, Olga Speranskaya, Andreas Prevotnik, Neidi Cruz, and Daniela Duran. Welcome, and welcome everybody who is attending this webinar, who's joining us today. Let's reimagine a planet that is better for us. It's time to do something. Thank you very much, dear Dr. Calle. After this institutional greeting, I would like to introduce myself. My name is Berta Luz Pineda Restrepo, social scientist and coordinator of the Committee on Climate Change and Inequalities of Orasconu. I am going to be moderating this webinar. Next, we would like to warmly welcome Daniela Duran. She is a senior legal advisor and advocate from the Environmental International Rights Center. Daniela is a social scientist and she has a master's degree on environment and development by the London School. She is a Colombian environmental activist. And at the Environmental International Rights Center, she leads all of the processes regarding inclusion of adequate provisions for the global treaty to eliminate pollution by plastics. She has a very vast experience in working with civil society organizations to strengthen environmental policy with an approach on the reduction of the production of plastics. She has a vast experience working with environmental organizations. She has advised different leaders from indigenous peoples to promote their participation and the recognition of their rights. She has also collaborated with Afro-descendant communities and recyclers and scavengers to strengthen their participation in the environmental policy and democracy. Dear Daniela, you have the floor, and thank you very much for participating in this webinar. Thank you very much, Berta. Thank you very much to Orasconu for the invitation to such an important webinar about negotiations of the Global Plastics Treaty. It is a pleasure to be here with you today. And so today I will talk a little bit about what is this initiative of the Global Plastics Treaty, what are the progresses made so far, and what are the main challenges of the negotiations today. And so I would like to start with this image of Antonio Gutierrez, who is the Secretary General of United Nations. And I would like to start by saying that the production of plastics has, of course, substantive impact on the triple planet crisis and human health. And it is one of the main challenges, one of the main crises that is definitely at the core of multilateral policies and global policies right now. So I would like to start by this phrase of Ellen Johnson. She is the former president of Liberia. She said, future generations won't judge us for what we say, but for what we do. So right now, we are at a key and historical point in our history, in our lives. And I would say that after the Paris Accord, we are negotiating global multilateral, probably after the Paris Agreement. This is the most important treaty. And we are actually having the protection of human health, human rights, and the environmental rights of future generations at stake. I think we have enough scientific evidence that indicates that plastics and the production of plastics are affecting human health, they are affecting human rights, and they are affecting the right to a healthy environment. We are at a critical point globally for the future, for our future. Now, where do we start? How does this start officially? In 2022, the Fifth Environmental Assembly of the United Nations met, and 193 countries agree to create a committee, an intergovernmental committee to negotiate. And from now on, I will just refer to it as INC, because this is how we call it in the negotiation and it's easier. So this committee, this INC, had different purposes. First, to develop a legally binding instrument to deal and address the plastics pollution, even in the marine environment. And then two things that are absolutely important, which is this mandate, which is the one that actually triggers all the negotiations. First is that this treaty has to have a comprehensive approach that will address the whole cycle of life of plastic. We do have enough evidence indicating that the life cycle of plastic starts with fossil fuel extraction. Let's not forget that 99% of all of the plastics that we consume and that are produced and that we're constantly in contact with come from fossil fuels, from oil, gas, and coal. And so the life cycle of plastic starts there in the extraction, and it starts and it includes the production and consumption of the plastics and the management of solid waste and also the permanence in the environment. And so there is a key point here. Usually, sometimes we believe that when we talk about the global plastics treaty, we're talking about the solid waste management. But it's not just that. When we talk about the plastics treaty, we're talking about a treaty that is all encompassing. It includes the whole life cycle of plastics, and it is directly related to the supply and demand of fossil fuels and the climate change and protection of human health. So there is increasingly more it's not just about waste management, but it is a treaty about the impact on human health and has a much more holistic view of the problem. And then something else that is also absolutely key of this mandate is that it recognizes that plastic contamination has fundamental and critical impact on human health. And this is where it all starts, right? This is where this whole story starts. And how this has been developed. Well, they agree that INC, the committee that I already told you, the Intergovernmental Negotiation Committee, where 193 countries meet, they start meeting to negotiate, and they agree that they are going to have 5 negotiation sessions. The first one happened in Uruguay in 2022. The second one happened in Paris mid-2023. The third one in Nairobi in Kenya at the end of 2023. The fourth one, which is the one that we attended recently, was in Ottawa, Canada in April. And we are now progressing towards the 5th session or negotiation round of this treaty, the 5th one of these in INC. And we expect that in 2025 that there is a plenipotentiary conference where all the congresses can sign finally the treaty that has been developed in the past 2 years. Something that's important to take into account is that we are here. This is where we are. There is going to be, of course, an intersession technical work, between the sessions that we had in Canada on April, and the session that we're going to have in Korea in November. This intersession work is going to be a technical work where we're going to have experts to discuss topics that are absolutely critical to talk about human health. The first one is what are going to be the criteria, or all of the criteria that we can talk about, that criteria to define the concerning chemicals and the problem countries that this problem will have, and then what are going to be the ways to implement this. So this is the timeline that they proposed for INC. And really, the reality is that it is a little bit difficult for us to have a treaty that will actually and effectively protect human health. I don't think we're going to have it in Nairobi, but well, what happened? What has happened in these 4 negotiation rounds that we've had so far? The first one is we met in Uruguay. And what we saw is the countries just tangling up the web, tangling everything about what were the rules of procedure that we were going to have and how the countries were going to get organized to make decisions. Is it going to be by consensus? That is, we all have to unanimously agree, or will there be a possibility of voting? That is, if all the countries get all the way to the last instances and they do not agree, are we going to have a voting process? And this is where we started to have, some negotiations, and we see some countries, which we will see that are the countries that are a little bit opposed to the measures that are critical for this treaty to really meet the goal of stopping pollution by plastics and to really protect human health. Then we go to Paris for the INC number 2, the negotiation round 2. We, hope to have a more substantive negotiation. Countries exchange about their views of what the treaty should contain, what are the elements, the obligations. But then we again found this, discussion about the rules of procedure, where the countries that are more opposed to the process, to having an effective treaty, really make this, not to advance and progress. We cannot vote, and so everything has to revolve around consensus. So that means that if there's one country that is not agree, then the negotiation had to start all over again, and so we're running into a wall. And then we go to Nairobi in Kenya, and we start with a draft, that contained all of the basic obligations, and we started exchanging ideas and visions about this. And then there's a lot of hope that we can actually have an intersessional work between Nairobi and Canada that would allow to move forward with the elements that all the countries should have, and in order to advance the negotiations. But then what happens? We don't reach consensus. And so we go to Canada, and we leave the possibility behind of having any intersessional work. So what happens in Canada? Well, we get to Canada, all the countries arrive in Canada with a text that is huge, it's gigantic. So we go from having a very concrete, concise text to this huge text that went from 30 to 100 pages. And then what we find in Nairobi, in Canada, so she apologizes, that we finish with a text that has more than 3,000 parentheses. That is, everything is in the parking lot. Everything is disordered, with very little agreement. But well, we were able to get the intersessional work to reach 2 agreements on concerning chemicals for human health, and how to implement this. So what are some of the critical points in this negotiation? And I would like to split this in 2. One in terms of the just the way, I was telling you before that that ideally there was a timeline to have the agreement signed, but the reality is very different, right? And so I was telling you that we have a text right now that is very disorderly. It's going to be very difficult to negotiate in the last negotiation round in Korea. And so right now we are in the right now and we have more time to negotiate, to be able to really have a treaty that will protect human health. Or, maybe we end up with a treaty that is somewhat weak and will not really meet the purposes. So we believe that we should prioritize maybe having more time for negotiation to actually have a treaty that will protect human health instead of doing it faster and having a weak treaty that is not going to really meet the purpose. But this is, of course, a very complex discussion. It has a lot of angles to it. And so definitely this is going to require a change in the dynamics and of negotiation. And this is the second part, which is the substance of this. And this is consensus. I was telling you that in INC1, we were not able to really define whether if what happens if all the countries do not agree, because we do have some countries that are completely opposed to this. And the problem is that the world can be stuck. The whole treaty can be stuck because one or two countries do not want these measures to protect human health. So it will be completely fundamental that for these negotiations to advance well, we have a reset, of the whole negotiation dynamics that will allow to overcome these barriers of having the whole world stuck just because one or two countries do not agree. And then in terms of content, what are the key points in terms of the substance of this treaty that are being discussed? First one has to do with the objective and the scope, because here, this is where we have human health being discussed. Something key, something else key, which is control and reduce the production of plastics. There is an overproduction. We produce much more plastic than we can actually deal with. There is this whole discussion of eliminating the concerning chemicals of concern for human health, also eliminating some problematic products and avoidable products, and to foster the reduction, the demand. Also, having goals to reuse. And during the introduction, they were telling us that half of the plastic is designed to be single use. Well, we can also talk about reuse, not only for plastic, but also we can talk about other materials that are safer for human health. We also have this issue of transparency and access to information that Olga will talk about during her presentation. Solid waste and management, control, trade, and means of implementation. But I want to, start wrapping up my presentation talking about these 3 points that are key, at least for us here at the Institute. It is key for us to have a treaty that will actually stop contamination and protect human health. So in terms of the objective, we have a text that is quite, as you can see, quite full of brackets, disordered, etc. But, among all of these elements that are being discussed, it contains the protect human health and the environment. And this is key because this allows to interpret and to give a vision to all of the measures that this treaty has. And the second one is the scope, what is contained and what is not contained in this treaty. So the resolution, so we are talking about the whole life cycle of plastics, and this includes the production, consumption, and waste management. But we do have some countries that are putting pressures so that this is a treaty only for solid waste management. And this has implications, of course, for protection of human health. And so a lot of the impacts on human health occur during the production of plastics, where a lot of chemicals are released. These chemicals are toxic for human health, or during the use and consumption. So in terms of production, more production of plastics, it means more contamination and more impact on human health. A treaty that protects human health has to control and reduce the production. It's critical because more production means more microplastics. And the degradation of plastics and microplastics is a general characteristics, and it is inherent to all plastics. Well, the more polymers, the more plastics are produced, and more exposed we are to microplastics. And we know now that they are in our bodies, in breast milk, in the liver, in the brain, and on the skin, in the lungs, in the spleen, in the stomach, in the brain, in the heart, in placenta. And 2 weeks ago, there was a study confirming that it is also in the testicles, the microplastics. And it has impacts. Of course, microplastics are related to inflammatory diseases. For instance, they are vectors of virus and bacteria. So the more production, more exposure to microplastics, and there's more impacts on human health. More impact, more chemicals, and we know that plastics has over 16,000 types of chemicals, and that it is impossible to produce plastics without there's more plastic production, more exposure to chemicals. And then the other key point is that the more plastic production, more impact on climate change. We now know that the production of plastics by 2050 will consume 31% of the carbon budget that we have in order to meet the goals of the Paris Agreement. And this is a lot more than what transportation and energy will consume. And we also know, and it is recognized, that all of the greenhouse effect gases and climate change also has important effects on human health. So this is a holistic problem, and this treaty should control and reduce production if we really want it to be successful in protecting human health. And then the last element for content, key element, it doesn't mean that this is the only one, but this is the ones that I decided to talk about in my presentation, is the chemicals of concern. As I told you before, plastics contain over 16,000 different types of chemicals. At least 4,200 of them are of concern for human health, and about the rest of them, we don't even have information. A treaty that will protect human health must eliminate all of the chemicals of concern in plastics. And then how can the treaty achieve this? Well, we already have a lot of information and scientific evidence, reports, experts available about what are the criteria that this treaty has to define in order to define the lists of chemicals that should be eliminated because they're toxic and because they are dangerous for human health. And something key, something else that this treaty has to do is to work with groups of chemicals. If this treaty eliminates just one chemical, the risk of this chemical to be substituted or replaced by a similar one, it's very high. We see in the market one chemical that can be replaced by another, and this happens now. And so it is important for this treaty to eliminate the groups of chemicals like biphenyls, to eliminate the impact on human health. Something critical also is that we need for the approach of chemicals of concern is one that is based on the danger or hazard and not based on the risk. When we talk about a hazard-based approach, we say that chemicals have characteristics that are inherent to their existence, that possess a hazard for human health. But when we talk about a risk-based approach, we say, well, there may be an acceptable level of exposure. But really, these chemicals have inherent characteristics that make it not acceptable. We need to talk about this based on the inherent characteristics and not thinking that maybe, there is some level that is acceptable. No, if we really want this treaty to protect human health, we need to do this. And then I just want to talk about two challenges that we have for this treaty to really have a, good result. First is, and I already told you about, plastics are actually fossil fuel in a different form. And so what we see is that some countries that are very interested in continuing to produce fossil fuels, and that plastics are just like a plan B to keep on producing fossil fuels, and some of them are very opposed to these obligations that are looking to reduce production that are key for human health, and some of them are even reducing the level of emissions to eliminate the chemicals of concern, which are absolutely critical. So one of the most important challenges is to see how the countries and how the Intergovernmental Committee can overcome the barriers that this group of countries are putting for the effectiveness of the treaty. And then the second one, I already talked about this, are the challenges about consensus. We cannot have a world stuck by just a group of countries that have a conflict of interest and they want to continue producing these plastics. And then finally, a key point for the fifth round of negotiations and some key messages. First one is this intersessional work that is going to happen in August, where we're going to start discussing all of these technical issues about the criteria that could be included here. It's also important for this intersessional work to focus on the lists of chemicals, but there will be a limited participation, so it's key to really say that these intersessional work has to have the presence of experts and they should be free of conflict of interest so that we can have good results. Second key message, to protect human health, the obligations to control and reduce progressively the production of plastic should be considered as indispensable and advanced. Right now, they are a little bit on the tightrope because some countries are saying, no, we cannot do this. And even the most ambitious countries, they say, okay, it's okay, whatever. No, we definitely need to get to Korea with a clear vision that these obligations are indispensable to protect human health and they should stay there and advance. And lastly, it's key also that we can have more time for the negotiation so that we don't really do the mistake of, okay, let's do this faster and we will have a weak treaty. And I think we need to go back to having, a really good negotiation time so that it is useful for the process. Thank you very much. Thank you very much, dear Daniela. Very interesting presentation. You gave us very valuable information about history and the challenges of the global treaty to eliminate pollution by plastics. You also highlighted the pertinence and urgency and relevance of negotiations, the importance of strengthening content and the scope and the objectives, and also the emphasis on the protection of human health. The emphasis on the big dangers that plastics pose. And definitely we have been getting a lot of congratulations in the chat box and also some questions. And so we would like to ask you to stay online because after the presentations, we're going to have a Q&A session. Next, we are going to give the welcome to Neidy Cruz. Neidy is the Associate Director of Sustainability of the global team of Salud Sin Daño, or Health Without Damage. She leads the global sustainability program. She coordinates all of the work in plastics, sustainable procurement, waste management, and chemical products in collaboration with different partners of the global network of Salud Sin Daño. It is headquartered in Mexico City, and she has over 15 years of experience in building global networks and working in sustainability, cooperation, and international policies, international negotiations, climate change, and social development. Before joining Salud Sin Daño, she was the Deputy General Director of International Cooperation at the Department of Environment and Natural Resources in Mexico. Neidy has a broad experience as a negotiator in multiple international, bilateral, and multilateral agreements. Thank you very much, Neidy, and thank you also for your team and Salud Sin Daño for coordinating this webinar. We would like to remind the speakers to please not to speak so fast so that we can also help the interpreter do her job. Well, thank you very much. Thank you for the invitation. Thank you, Daniela. Thank you, Ciel, Olga, Andreas, all of my colleagues. I think we're all part of a camaraderie group and even like a brotherhood. So one of the things that I want to talk about as well, the technical part, I'm going to go faster. I just want to highlight what I want to highlight the most for you is that amidst this new treaty that we want to get in this, well, in this multilateral treaty, what about the doctors, health professionals, nurses, physicians, and everybody who work at hospitals and health establishments and laboratories? What's our role in this treaty and in this negotiation? Well, to begin with, as was mentioned before, this crisis is a health crisis. And one of the first few meetings that Daniela talked about, we actually asked for the floor, and on behalf of the whole healthcare sector, we stood up to say, you need to pay attention to this. Please, governments of the world, this is not just an issue of waste management and contamination, visual contamination. This is also an invisible contamination in our bodies, unfortunately. So this was mentioned by Daniela. I am not going to really focus on this or linger too much on this, but I just want to say that without really noticing, we're suffering the consequences of the whole life cycle of plastic. But also something very important is that finally all of us are the ones that are the users and buyers of these products. And so we have a power as consumers, and especially in the plastic sector, in the healthcare sector. According to the estimations and audits that we do at Salud Sin Daño, we estimate that between 22 and 83% of all the hospital waste are plastics. And obviously, this is a big range, right? I said 22 to 83%. Of course, 22% in some regions and 83% in other regions, because we're not just talking about waste that are medical products, but sometimes this waste includes plastic waste from the food and catering services in the healthcare sector. So anything that has to do with the catering service for hospitals, water bottles, and many of the details. And here, I don't know where I'm moving. I don't remember where the slide is. Anyway, there was a slide to give an example from the United States. And actually in Latin America, we also have a big case that we were able to get to different scenarios. And this is a case showing that we can use less plastic. And many of the people here, I hope that you are part of the global movement that we are building and of Latin American leadership to show that the healthcare sector can be different. You know why? We already said this, because we depend on One Health. And the crisis that was mentioned at the end of the day, the only thing that, the COVID-19 pandemic reminded us that our health, it depends on the planet's health and also animal health. It is not possible to give health to people if the planet is sick. And so that's why we need to promote that in the healthcare sector there is an awareness, an ethical awareness that we should not harm. And the healthcare sector as an economy represents 10% of global economy around the world. And in the United States, it's almost 20%. So the whole supply chain, just to give an example, accounts for 70% of the carbon footprint of the healthcare sector. Obviously, just like any other industry, this 70%, you know, of the supply chain is also added by the high use of the fossil fuels for many of the processes and transportations that are used indirectly or directly. So if the healthcare sector, and this is one of the first few things that really shocked me, if the healthcare sector was a country, according to Salud Sin Daño and the estimations we did, we have this report saying that if the healthcare sector was a country, it would be the 5th top emitter. You know, dear friends, it would be the 5th emitter. It is just below the United States, India, China. It's more than Mexico as a whole country. And you know, this is a huge footprint, carbon footprint, and that's why there's more and more movements around the world to be able to stop this process, and that a decarbonization of the healthcare sector should include other elements, sustainability and environmental issues like sustainable procurement, which is, you know, waste management, and of course, the reduction and detoxification of plastics in medical care. We have different successful case studies. Fortunately, we have one in Brazil, Colombia, United Kingdom. In Europe right now, there is a project called, or when a movement that, you know, that is called to be born with plastic free, to be born plastic free. And so this is to measure everything, every plastic that a newborn is exposed to in order to reduce that. We have a lot of experiences of audits in the Southeast Asia, in Latin America, also in the United States, in Europe, and there's even in Australia one specific project to reduce single-use plastics at the hospitals. There's also kits, you know, toolkits, case studies. There's so many, you know, studies done, a lot of evidence, and we are trying to promote a movement that will generate education, and maybe with pilot projects we can provide information that is needed and all of the evidence that is needed that will then turn on a policy position. And we need to, I think, get this movement bigger. Oh, this is the slide that I wanted to show you a while ago. This is the example on last year's report in 2023. Practice Green Health is the network of sustainable hospitals in the United States, and they are also a member of the network, the GGHH, that you probably know, GGHH. And so this is where you can see how we've been able to reduce up to 82% of reusable containers. I've been able to identify plastics. You can see here on the, you know, the straws, you know, cafeteria, catering. So if you actually look at the highest use, we don't even find them in the, you know, essential items for healthcare. It's mostly ancillary services. And that's why we need to really have the information and to look for alternatives for this. And right now, the global team is part of a very interesting project of identifying alternatives to single-use textiles, which are also mainly plastics. So I'm not going to talk about all of this. I just want you to know that there are a series of materials and guides and resources that are available for the healthcare sector who is willing, you know, to look at policies or leadership, decision-making, procurement, all the way to auditing or how to do this in the OR. Also, there's also some resources in Spanish that there are not in English. I think, you know, the team at Salud Sin Daño has been a leader on this. So definitely, I invite you, to all of you Spanish speakers, to use these resources. And that's why Salud Sin Daño has participated in the very first meeting in the first round in Uruguay, we have spoken up because we were observers, but fundamentally demanding that the treaty is an all-encompassing treaty that includes the whole life cycle of plastics, that the production is reduced. We definitely need to reduce production. We need to know the content and transparently. I think Olga is going to talk about this too. It's so important for the healthcare sector that there are no, false or fake solutions, because I think there is an internal document for guides and principles of circularity for the healthcare sector, because this false concept that now everything is green, just because they brand it as green, that is really not positive and incorrect. For us, it is very important that all of the, decision makers and negotiators of the different governments have the information and that they use evidence-based information. Also, of course, we are combating this, we're combating a market and fighting a market. And I don't want to say that we are fighting an industry, but in a way we are. That's why part of our job is to have a dialogue with the private sector, with the producers of the services and the products of the healthcare sector, fundamentally that are made out of plastic. And we have found a lot of things recently, for instance, and I didn't want to put this image, but I just want you to picture in the last session that we participated in Canada, we saw something that we had never seen before, and it was the communication campaign that was orchestrated by the industry. Images that were circulating in trucks and cars in the city where we were meeting, posters and banners that were posted all around the convention center, printouts and t-shirts, and all of these that were saying that plastics save lives, with the image of a girl in a hospital with a ventilation mask that is made out of plastic, and a teddy bear, right? Images of a person that is in a, conflict area drinking water, saying, plastics keep water, plastics keep you alive, keep food. I mean, it was a very well done campaign, I think, but it can also be misleading, right? It can be misleading, it can be deceitful, and, in terms of the messages. So for us, it is very important to give the right messages from the healthcare sector, from, the voice of professionals. And that's why we have built a series of documents that are available now, for now, only in English, but they are being translated in Spanish in this coming month. Plásticos y Salud, Plastics and Health. Why? Because the plastic crisis and the plastic treaty is an agreement on climate as well, because this is just another fossil fuel for us. We have also produced a series of proposals of what the treaty should be, and then also how this is related to chemicals and the negotiation of a toxic-free world. We say we will keep on highlighting that this is a global movement for health, for environmental justice. It is important to learn from our mistakes. The COVID-19 pandemic and the WHO and PAHO, they have launched already reports showing that over 45% of the plastic inputs and items that were promoted during the pandemic were unnecessary. So this is just a battle against consumption. And something very important that we're mentioning from, the get-go, from the beginning of the negotiations, because we already saw this coming, that should not be general exceptions, and that there should not be any exceptions for healthcare sector, no matter what the outcome is. And so obviously from the third meeting in Nairobi, there were countries that requested for an exemption for medical products. So we are trying to show with evidence all of the information that exists, the difference between medical devices, medical products, non-essential products. Here's so I'm about to wrap up now because I know that I have 2 more minutes. We have been speaking up around the world, and actually, well, I'm going to skip the slides. You have the presentation so you can take a look at it afterwards. But there's more, materials and campaigns that exist. This is both in English and Spanish. You can use these videos, interviews. The campaign that we launched, Doctors Prescribe No Plastics. And then I would like to wrap up talking about this letter. And probably you all signed, some of you signed it. Thank you very much. This open letter. And this was an effort that we led at Salud Sin Daño precisely to send it to the negotiators of the treaty. This letter from physicians, nurses, medical professionals, medical providers, different professionals in the healthcare sector that all around the world spoke up to say, you know what, this has to be a legally binding treaty. It has to be ambitious with no exceptions for any sector. But of course, having special considerations, which is different. And then WHO also has talked about this in the past meeting, which made us very happy because for the first time, they talked about this in Canada. They said the WHO recommends that there are no exceptions for the medical or the healthcare sector. That made us very happy, and I think we should keep on working on this. We are speaking up to say we have a lot of single-use products that are unnecessary. There's fascinating stories, and personally, I've had the opportunity to talk to doctors and physicians that are committed, saying, "Stop! It's not possible that at home I want to talk to my kids saying that we should recycle, and then I go to the OR and I see that everything is plastic, the wrapping and the everything." And so now there's more analysis, more scientific evidence in how we are producing all of these consumption just because they are safer or necessary, but because it's just a consumption. So this letter was signed by over 1,000 people. Here there's the QR in case you want to add it to this. You can open this QR code, scan this QR code, and then there is a form you can fill out and you can sign. Fortunately, we keep on getting signatures. We have over 1,000 already, individuals, so not countries, but people and organizations. And the organizations that you see here on the left, just because of the like the membership, you see here the World Federation of Medical Students, the International Society of Doctors for the Environment. And so this was signed by over 73 countries and represents over 6 million professionals. And we will keep on doing this work. We keep on really getting closer to professionals, healthcare professionals, to give them this information, to help them to identify with proposals. Thank you very much on behalf of Salud Sin Daño in Latin America and global office, and thank you to everyone who's here this morning. Thank you, and also this afternoon for Olga and Andres. Thank you, Nidia. It's been a great conference, and you have been talking about the crisis and that this is a healthcare crisis, and that it is so important to think about the healthcare sector and the role that it has, and to look at the environmental crisis. Healthcare professionals, we have the ethical and moral duty of working plastic-free. And we can start by signing the open letter to the healthcare professionals and to keep on participating on this. I want to say that we already shared the link. There were people that were asking for the link of the letter. So on the YouTube Live and Facebook Live, the link is there. So we would like to ask you to stay online. We have been getting comments, congratulations also. So after the next two presentations, we're going to have a Q&A session. Thank you very much. Next up, we would like to welcome warmly Olga Speranskaya. She's the co-director at an organization that is called HEJ Support. Olga is a Russian scientist with a PhD in physics. She has over 30 years of experience in research and project management. and also consultancies in environmental health topics. Since 1997, she has been working to raise awareness about the dangers to health of toxic chemical products. She has significantly contributed to the capacity building of over 500 nonprofits to promote leadership of women and gender equality. She is also promoted and raised awareness and the action regarding vulnerability of women, boys, and girls to exposure of chemical substances. She was awarded with the Goldman Environmental Award in 2009, and she was named champion of the Earth of the United Nations Environmental Program in 2011, based on her work in 12 countries of Europe, the Caucasus, and Central Asia. Olga is the principal and senior advisor for many organizations. She has a vast experience in education and scientific outreach. She works in different countries in capacity building projects to implement agreements on chemical products, awareness, and capacity building in terms of social justice, environmental justice, and health. She has given many keynote speeches internationally, and she is an author of different educational material about the advocacy of environment and health. Olga is going to give the keynote speech along with Andreas Prevotnik. He is the main advisor and policy for the Swedish Society for the Conservation of Nature, headquartered in Stockholm. Andreas studied global environmental policy and environmental sciences. He has a master's degree on environmental engineering and a PhD on ecotoxicology. Andreas has a broad experience as an advisor for policies on chemical products, circular economy, and efficiency of material resources. He also has different publications under his belt about these topics, and he participates in different projects, for instance, in Africa. So, dear Olga and dear Andreas, the floor is yours, and thank you for your participation and your time.
Okay, so thank you so much, and good morning, good afternoon, everyone. So muchas gracias for the opportunity to meet and discuss why it is important to ensure that Global Plastics Treaty considers the transparency of chemical information in plastics and its traceability in individual plastic materials and products. So yes, I'm a co-director of Health and Environment Justice Supports, and he supports together with the SSNC and Groundwork South Africa and many our partner organizations, including in Latin America, have been working on transparency and traceability of chemicals in manufactured materials and products, including plastics, for quite a while already. And I hope you can see on this slide, there is a link to our websites, globalchemicaltransparency.org. And I really encourage you, so please go to this website where you can find a lot of information on transparency and traceability of toxic chemicals. And next slide, please. Yeah, so yes. Thank you. So why is it important to discuss the issue of transparency and traceability when we talk about health and plastics? So first of all, we believe that transparency of chemical information in materials and products and its traceability in individual products are the basis for informed decision-making by all stakeholders involved in the production and use of plastics and plastic products. Both transparency and traceability are key approaches to a resource-efficient circular economy that should be free of harmful chemicals. And this vision has been outlined in a recent report by researchers from Norway called The State of the Science of Plastic Chemicals, that Daniela already mentioned, by saying that more than 16,000 chemicals are used in plastic, of which more than 4,200 are recognized as hazardous. However, actually, there is not enough information on remaining nearly 12,000 chemicals to prove whether they are harmless to humans and the environment. And this report concludes that actually no plastic products are chemically safe for humans, and it justifies that the importance of transparency in the chemical identification of materials and products throughout the plastic life cycle. But last year, UNEP conducted a similar study on the chemical content of plastics, and a technical report was released noting that plastic contains 13,000 chemicals, and a quarter of these chemicals are known to be toxic. So you can see that the information about chemicals in plastic is constantly changing. But the only thing that doesn't change is the extremely low level of disclosure of this information. So ideally, full disclosure of information on chemicals in plastics should be available to all stakeholders. However, to begin with, at a minimum, all stakeholders need to have information on chemicals in products based on the hazardous properties such as of such chemicals. So, as it was mentioned by Daniela already, before INC4, some countries tried to develop criteria for chemicals to be included in the so-called negative list of chemicals to be banned or restricted in plastics under the Plastic Treaty. And of course, more work will be done in the intersessional period that Daniela also referred to. However, it is very important to know that such a negative list of chemicals in plastics is insufficient to ensure a circular economy free of harmful chemicals. So similarly, having design criteria for plastic products that must not include hazardous chemicals is insufficient to ensure a safe circular economy. So there is definitely a need for traceability of such information in individual materials and products. So why? Firstly, we do not know which substances will be included in this initial list of chemicals to regulate their use in plastics. For example, it may only include substances that are already banned internationally, which is only like a tiny percent of known hazardous chemicals. Also, it is not known whether the initial list of hazardous chemicals in plastics will include all 4,200 chemicals identified in the Norwegian report, or the 3,200 chemicals identified by UNEP in 2023. But either way, the list should be live, meaning that it should be open to the inclusion of additional chemicals to control and ban in plastics. However, not all chemicals that would be on this initial list of hazardous chemicals can be immediately banned or restricted, because the industry claims that, for instance, there are no good substitutes so far. Thus, if these chemicals are present in the life cycle of plastics, they need to be tracked in individual plastic materials and products. And in addition, chemicals already banned or severely restricted in products need to be tracked to avoid recycling of products containing them that leads to their reuse in new products made from recycled materials. So why does this happen? because there is still no globally harmonized approach to tracking these chemicals in products at the level of existing chemical conventions. And next slide, please. Next slide, please. Yes. So, yeah, it is still I guess. So, how many chemicals are already regulated globally? So a simple answer is that about 4% of chemicals in plastics are regulated. So many more chemicals in plastics are not regulated, but are released into the environment throughout the entire life cycle of plastics. And next slide, please. So what chemicals are prioritized for regulation? So next slide, please. So of course, countries prioritize chemicals with hazardous properties. So these properties were identified in the UNEP Chemicals and Products Program and adopted in 2015. So the program defines these properties as substances that are persistent, bioaccumulative, and toxic. They may be carcinogens and mutagens, or that adversely affect the reproductive, endocrine, immune, or nervous systems. And next one, please. So next slide, please. So these, given this criteria, which substances should definitely be included in the so-called negative list of the new plastic treaty for strict control and ban? So these chemicals are regulated by several international and regional agreements listed on this slide. But of course, we don't have time to go through each of these agreements. And so next slide, please. And I would like to focus specifically on the Stockholm Convention on Persistent Organic Pollutants. And I believe that everyone knows about this convention. The Stockholm Convention is the ban convention. It bans and restricts persistent organic pollutants. For now, 17 out of the 34 persistent organic pollutants are related to plastics and are controlled by the Stockholm Convention. Out of these 17 persistent organic pollutants, 14 substances are included in Annex A of the Convention for global elimination, which also includes a number of specific exemptions. So at the last conference of parties to this convention, 2 plastic-related substances were listed in Annex A, namely the plastic additive UV328 and the flame retardant Dechlorane Plus. And in addition to all this, 2 new plastic-related substances are recommended by the Stockholm Convention, a new POPs Review Committee for inclusion also in Annex A of the Convention for global elimination and phase out. And these additional plastic chemicals will be suggested for inclusion at the next conference of parties and to the Stockholm Convention next year. So although the Stockholm Convention Expert Committee recommended the inclusion of these substances in the annexes to the convention, a significant number of specific exemptions were negotiated, which allow the continued use of these substances in various materials and products. And how should consumer and other stakeholders know about the presence of these toxic chemicals in products and, in our case, in plastic? So next slide, please. So the question is, yeah, next slide, please. So is there a mechanism under the Stockholm Convention that ensures transparency and traceability of persistent organic pollutants in products, in articles which are manufactured products, and in waste? Actually, there is an article under the Stockholm Convention, Article 6, that mandates parties to develop strategies for identifying products and articles and waste containing chemicals listed in the annexes to the convention. However, the Stockholm Convention lacks harmonized global disclosure requirements for persistent organic pollutants in products, including plastics. And the absence of globally harmonized requirements on the disclosure of persistent organic pollutants in products under the Stockholm Convention actually negatively impacts the implementation of the Stockholm Convention itself, as well as the Basel Convention that regulates waste transfer, right? Despite the Basel Convention's requirement for full waste characterization, the absence of globally harmonized transparency and traceability of persistent organic pollutants in products under the Stockholm Convention leaves the content of any given batch of plastic waste a mystery, posing a potential threat to the implementation of the Basel Convention. So, no globally harmonized requirements under the Stockholm Convention on transparency and traceability of persistent organic pollutants in products, including plastic, leads to toxic circular economy, a recirculation of all these harmful chemicals into new products manufactured using recycled materials. Also, waste recyclers actually unwillingly become producers of a toxic resource because they do not know what chemicals are in waste that they recycle. And next slide, please. So how can the future plastic treaty address the problem related to persistent organic pollutants and other toxic chemicals in plastics throughout the entire plastic life cycle and various value chains? So it is obvious that countries become better aware of the problem of toxic substances in products, including plastics, and the need to disclose this information to make informed decisions, both at the level of suppliers and product manufacturers, as well as at the level of regulators, retailers, consumers, and recyclers. And as a result of ongoing negotiations, the draft plastic treaty text contains a list of articles related to chemicals in plastics. And this draft plastic treaty was discussed at INC4, as Daniela mentioned, last year. And it also includes an article on transparency of information on chemicals in plastic and its traceability and labeling in specific plastic products. So the text of this article, Article 13 on this slide, includes a globally harmonized approach to both the disclosure of such information and its traceability in individual products. So an example of such disclosure of information on chemicals in consumer products already exists, but at the regional level in the European Union. And this is the so-called database of substances of concern in products on the EU market. And chemicals of particular concern under the EU chemical regulation, REACH, must be disclosed in products and in their individual components at concentration of 0.1% by weight. And the data must be reported to the European Chemical Agency. This requirement applies to products manufactured in the EU, imported into the EU, and to waste that may become secondary raw materials. So this information transparency requirement applies to all EU producers and to importers of materials and products to be placed on the EU market. And next slide, please. So we believe that, next slide, please. Yes. So we believe that a similar approach applies to the plastic treaty itself However, it should be developed and agreed upon globally. And the current draft of Article 13 in the Plastic Treaty text, as I said, it already includes the text on the harmonized legally binding requirements to disclose information on toxic substances in plastic. And this requirement is favorable to governments, to businesses, to consumers, recyclists. We believe that countries started understanding this pretty well. And now I would like to give the floor to Andreas to discuss a little bit how transparency and traceability of chemicals and plastics can be achieved in practice. Andreas, please.
Thank you very much, Olga. Can we move to the next slide, please? So, as things stand at the moment in the treaty discussions, there is already widespread support for Article 13 across all spectrums of countries, from low and middle-income countries to also high-income countries. And in this slide, you can see a few of the examples of countries and their support for Article 13. So Thailand said that it's a key article that will enhance the effectiveness of the treaty. And furthermore, Thailand also said that disclosure of toxic chemicals in plastics is necessary and that information should be in a public database, similar to what Olga talked about with the SCIP database in the European Union. Kenya, for example, stressed the importance of a digital tracking system for disclosed chemical information in individual plastic materials and products, and a central database for the management of the data. And also harmonized labeling requirements is necessary. This is what Kenya said. From the perspective of low and middle income countries, it's important that the treaty then secures technical and financial assistance so that these systems can be put in place and operated. Many of the low and middle income countries are net importers of plastic products, not producers. So they would clearly benefit from having this information associated with the imported articles and could thus save a lot of costs and time from doing expensive chemical analysis. Next slide, please. So our advocacy team has prepared a number of information papers that have helped building the capacity of the delegates on transparency and traceability systems, which in turn made it easier to mainstream the topic in the treaty discussions and get the support that we now can see from the countries. Our latest information paper that was prepared for the INC meeting in Ottawa addresses a number of questions that we collected from country delegates in the INC process leading up to INC 3. You can see the questions here. Among other things, the country delegates wanted to know if the globally harmonized system for classification and labeling of chemicals and chemical mixtures, GHS, could provide the basis for chemical information disclosure and sharing of the information in plastics. They also wanted to know how the transparency and traceability system could look like and work in practice. And this is what I will focus the rest of my presentation on. Furthermore, they would like to know if there are any issues related to protection of confidential business information and how a transparency and traceability system would be compatible with World Trade Organization rules. Next slide, please. Next slide, please. Okay, thank you. So we picked a question about how the transparency and traceability system could look like in practice as the headline topic of the information paper, and then address the other questions as sub-questions. And at the bottom of the slide, you can see the link to the information paper. It's on the website that Olga already mentioned, and there is a lot of other information material there as well. And when you have time, we recommend you to go to this paper and read it more in detail. So let's move to the next slide. So if we look a bit more in detail what we request in this, or what we explain in this information paper, we focus here on the question on how the systems would look like in practice and work in practice. To ensure transparency, we first of all need a harmonized system for disclosing and communicating information about the chemical composition of processing chemicals and additives used in the manufacturing of plastics. And this information has to be provided by the suppliers of chemicals. Delegates then asked us if the GHS would be helpful in this respect, and the short answer is no. The rationale for this is more elaborated in the information paper, but in short, GHS is non-binding. It only applies to chemicals and chemical mixtures and not materials. And it's only for hazardous chemicals, and it's also very heterogeneously implemented in different jurisdictions. For example, in the EU, it covers more hazard classes than, for example, in North America. And it's intended to protect both human health and environment, while in North America, it only covers health aspects, basically the occupational environment. The format and information disclosure and communication with safety data sheets from the GHS is fine, but there are simply too many gaps with the GHS system. It cannot address the kind of information we need for chemicals when they are integral parts of materials and products. Thus, we foresee that a new and globally harmonized and binding system for disclosing and communicating chemical composition information must be developed specifically for the Plastic Treaty. It might make use of expanded safety data sheets, but these must address the gaps that we identify in the information paper. This information would then be fed into what we call digital chemicals passports that I will soon get back to. Let's move to the next slide, please. And in addition to the disclosure condition, for information to flow smoothly and uninterruptedly between all stakeholders in the plastic value chains and throughout the life cycle of manufactured plastic materials and products, two additional conditions must be met. This is the condition of tracking and labeling and the condition of certain stakeholder responsibilities. So let's move to the next slide. Traceability for disclosed chemical composition and hazard information depends on marking and labeling of individual materials and products with what we in our information call data carriers. Embedded in the data carriers is also a product identifier. That is to say, a numerical and/or an alphabetical code that is unique to the material, component, or product. In the information paper, there is also a reference to a review article outlining different options for data carriers. There is no time now to go through them in detail, but you will find very comprehensive information about the advantages and disadvantages of the different types of data carriers if you go to this information paper, which is a reference in our paper. When materials and products become waste and are prepared for recycling, their data carriers may be destroyed. So to ensure that disclosed chemical information about the composition and hazard data in the materials or components or products is not lost at the end of life, it's therefore necessary that the chemical composition and hazard data is stored digitally in a database. And we suggest that such a database should be centralized at the global level. The data for an individual material, component, or product is stored in the database in a format that we call a digital chemicals passport. A passport with the same product identifier as is in the data carrier for the individual material, component, and product. Chemical composition data can then be retrieved from the database by scanning the data carrier, for example, using a cell phone with a dedicated app, and the product identifier in the data carrier will link you to the digital chemicals passport in question. We try to illustrate this with the infographics that you can see on this slide. So in or labeled onto a plastic product is the data carrier. It can be a QR code, barcode, or a watermark, for example. It is scanned with a cell phone, as I said, and the chemical composition and hazard data as applicable of the plastic product is retrieved from the digital chemicals passport in the center database. The chemical composition and hazard data as appropriate are displayed on screen of the cell phone. This may sound complicated at first, but really makes use of very simple technology that is available to most stakeholders, also in low and middle income countries. And we really don't see that there are any simpler ways around establishing traceability. If you want to have a circular economy that is not spreading harmful chemicals in uncontrolled ways with recycling, a prerequisite is that informed decision-making can be made based on information on the chemical composition of individual plastic materials and products. Next slide, please. But for the system that we have just now outlined to work in practice, it's also crucial that stakeholder responsibilities in relation to data registering in the digital chemicals passport in the database is clearly defined. And this could be developed in detail in an annex to the plastic treaty. All stakeholders that create new materials, components, or products for the market, whether of virgin or secondary raw materials, must be obliged to register the chemical composition and hazard data in the digital chemicals passport, as well as mark or label the plastic products or items with an appropriate data carrier. For example, manufacturers of plastic materials, components, and products must account for all additives, processing chemicals that leave traces in the final item, and monomers, oligomers, and polymers that compose the plastic materials and are used in the manufacturing process. In the case of using secondary raw materials, that is to say recycled materials, manufacturers must also include the chemical composition and hazard data as applicable, retrieved from the digital chemicals passport of the recycled materials, and compile them into a new digital chemicals passport for the new item placed on the market. Waste dealers preparing materials for recycling hence must create a digital chemicals passport for each batch of pooled plastic materials that they place on the market. Such digital chemical passports for recyclates shall include the chemical composition and hazard data from all plastic waste materials that were pooled when they recycled the materials, and that were retrieved from the respective individual digital chemicals passports of the plastic materials used for pooling the materials for the recycling process. And if any new additives are used or other processing chemicals that leave traces in the recycled materials, they should also be accounted for in this new chemical passport for the recycled material. These are the stakeholders with the obligations to enter information into the digital chemicals passports. Other stakeholders in the life cycle of plastics only have access to information from the digital chemicals passports. This includes, for example, retailers, consumers, and public institutions. Regulators, that you can see on the top of this infographics, they have access to the full information of the chemical composition and hazard data as for the materials, components, and products from all stakeholders, and can thus keep track of the chemicals in the products imported, used, produced, discarded, reused, or recycled in the respective countries. Based on this information, regulators can introduce and change regulations as relevant. Retailers and consumers only have access to information, as I said, and the defined responsibility conditions that I try to outline here is a bit difficult to explain in words, but if you read the information paper and look simultaneously at the information, this infographics that we have on this slide, you should be able to follow what we mean by defining stakeholder responsibilities. Okay, let's move to the final slide. So as the draft text stands at this moment, it contains, as Olga said, the essential elements that we want to see in Article 13. But now, of course, there are several options in the draft treaty text for how the sub-articles could look like. And the text is still bracketed. So they need to be fully negotiated. And this would take place at the last meeting, the INC5 meeting in Busan. At this meeting, we need to secure treaty text that establishes the mandatory globally harmonized transparency system for the chemical composition in plastic materials and products, so that reporting requirements and the format for dissemination to the stakeholders in plastic value chains can be defined once the INC process is completed in an annex to the treaty. That is to say, we don't need to negotiate all the details and finalize this at INC5. We only need to open the door for developing the details at the later stage. And the same goes when it comes to establishing the mandatory globally harmonized traceability system. We need text that now opens the door for establishing this, so that guidelines and the selection of labeling systems can be formulated at the later stage once the INC process is completed. And this could also be included in an annex to the treaty. And finally, we need to secure that the treaty text allows for the establishment of a global database for the management of transparency and traceability for the chemical composition data in plastic materials and products, with the option to define details once the INC process is completed. And for this, we need your support, of course, to convince your respective governments to make the correct decisions. And with this, I thank you for your attention, and thank you so much for the opportunity to present our work. And we are now happy to respond to questions, or if you have any suggestions for how we should proceed with the work. Thank you very much.
Muchas gracias.
Thank you very much, dear Olga, dear Andreas. It has been an exceptional presentation from both, with an emphasis on transparency and traceability of chemical composition of materials, components, and products made of plastic. These are key elements for more informed decision-making towards a circular economy. You have both talked about the Stockholm Convention and the progresses towards contamination, the POPs, and then you have also been talking about a key question that different participants have been asking, which is how can we actually have a transparency and traceability system in practice and implement this in practice? And also you have given emphasis on the fact that informed decisions should be made based on the evidence that exists, and this is key for decision making. Again, thank you very much. And we have gotten a lot of congratulations for you both, and questions also. Thank you very much to everyone who is connected, from the ministries of health, representatives of governments, representatives of the academia, and different entities and social organizations from Angola, Argentina, Brazil, Bolivia, Chile, Colombia, Cuba, Ecuador, El Salvador, Mexico, Paraguay, Peru, Poland, Uruguay, Venezuela, England, Spain, among many other countries that are represented today with the attendees. So we have gotten a lot of greetings and congratulations and questions. Thank you very much to all. We are now going to start the Q&A based on the questions that we received. We had several questions. The ones, the ones that some of them asked questions at the beginning, but they were answered by the following presentations, because there were many questions that were asked during the first, presentation, but then in the second presentation, they inadvertently answered the questions. and in the same way with the second and third presentation. So I'm going to ask a few questions. I'm going to read them all, and then in the order that in the same order of the presentations, you can answer the questions based on your experience and your perspective. One first question that has been repeatedly asked is how can they participate in the global network? How can they participate in the global network? Then there is another question about the concern about SMEs or micro and small companies that produce plastics. The main concern for them is because these, family businesses that have, employees, and how can we consider them also the MSMEs. And then they also ask about the effect of microplastics in the body. What more information can you give? And then the last question that I want you to answer, in whatever order you want, is also the concern about contamination, not only by plastics, but also by glass, cans, etc. What is your comment about these other products? So I will like to now give the floor to you, and you can answer, the questions in whatever order you want, or whichever question you want to answer. Thank you. So Bertha, so you said that we were going to go in the same order as we presented, right? So I will start maybe with a few reflections about how can you participate in the global network. Well, this is one that I will leave Nady to answer. But I just want to add that the participation of stakeholders that are interested in the negotiations is absolutely key, particularly, of all the stakeholders, but mainly those that are involved in the healthcare sector. The participation of observers is absolutely important for governments to understand where the bar is and what are the objectives that this treaty has to fulfill. So participating in negotiations, but also through conversations that you have with the decision makers in your respective countries, and to also talk about treaty that
elimine los productos problemáticos, que tenga una transparencia muy clara para los químicos en los productos plásticos es absolutamente importante. Con relación a la segunda pregunta de la preocupación por los empleos,
about
esta
this.
es una preocupación muy válida, es una preocupación que
About this.
Disculpe. En esta parte de
Daniela,
las
just in this part of the answers also, please make sure that you don't speak too fast. Otherwise, it's hard to interpret. Thank you.
Gracias. Sí, perdón. Con la segunda pregunta, que es con los
So
empleos,
about the second
es una
question,
preocupación muy válida,
which
es
is
una
the
consideración
SMEs and the
importante en
employment
el
for
contexto de las
micro and small
negociaciones.
businesses, right? It
Sobre
is
eso
also
quisiera
important for
mencionar varias
in the
cosas.
context of negotiations, and I would
pregunta
like to
primera
mention
es,
a few things.
la
First
idea
is
es
the
que podamos
idea that we
controlar y
can
reducir la
control and
producción hasta
reduce
alcanzar niveles que
production
sean más sostenibles a los que
down
tenemos
to a level that is
hoy. El objetivo es
sustainable. The
completamente
objective is
parar
that we're
y
going to
eliminar
completely
el
stop
plástico
and
o la
eliminate
producción de
plastics or
plásticos.
production of
Es
plastics.
producir de
So the
manera que
idea
lo
is to
podamos tener en
produce
niveles más
in a way that
sostenibles.
we can
Y
actually
no
have more
solamente
sustainable
eso,
levels.
sino producir
And not only that, but
plásticos que tengan
also
una
produce
mejor calidad,
plastics that have a
un
better
mejor
quality,
precio.
a better
Uno de los
price.
principales
And one of the
retos de la
main
sobreproducción de
challenges of
plásticos que estamos viendo hoy
overproduction
es
of
que los
plastics that
precios
we see
son súper
today is that
elevados.
prices are
En
completely
materia de
are
empleo
too
son
low.
absolutamente más
And so in
convenientes
terms
producir
of
plásticos
employment,
que
it's
sean de
convenient to
mayor
produce
calidad,
plastics that are
con
better
mejores
quality with
precios y
better
que pueden traer
prices,
incluso
and that can
beneficios
actually
económicos
have
a la
more
sociedad.
economical benefits for
Lo
society
otro
and
es
better
que,
salaries
al
for
menos en
people.
nuestra región
And
de
then
América
something else, at
Latina,
least
la
in
industria
Latin
de plásticos es
America,
muy
the
específica.
industry of
La
plastics
idea
is
es que
very
podamos
specific.
entender sobre
The
todo
idea
los
is that
plásticos
we
que
can
están diseñados para ser de un solo
actually
uso,
govern
sobre
the
esos
single-use
plásticos que
plastics,
tienen muy pocas
all of those
rotaciones,
plastics that
que no
have very
limpian, que no son
little,
seguros para la salud humana.
rotation, and that they are
En
not
nuestra región de
safe
América
for
Latina
human health. But
producimos
in
esto
Latin
muy
America, we have
específico
industries that
y
are
no esperamos que la
multi-specific.
producción completamente
So we don't
desaparezca, sino que
expect
se
that the
reduzca a
production
niveles
is completely
más
eliminated,
sostenibles.
but like I
Eso es
said,
algo que también
down
puede
to more
contribuir
sustainable
a que
levels. And
haya
this is something to
una
contribute
pierde una cantidad de empleos
to
importante.
have more,
Y lo otro es que, por
jobs.
supuesto, este
And
trabajo tiene que
then
estar
also this
acompañado
treaty
de
has
unas
to
medidas
come
de
with financing measures or some implementation measures that will support the implementation of the measures and a transition regime. And then the last thing that I want to say is that there are multiple alternatives for the products that are produced and that they have a huge job generation opportunity, especially in Latam. There's different materials that have also really great business opportunities. I listened, like, the reuse. There is one company in Chile called El Gramo, and which is successful. And I've heard about the products in Colombia with the pineapple residues to replace some of the packaging materials that are, biodegradable, that are safer in terms of chemicals. There's a lot of business opportunities, I think. And so the idea is that this treaty should not stop completely the production of plastics, but like I said, it should just bring it down to more competitive, sustainable, and safer levels, and that it allows to take advantage of these other business opportunities with other materials that, because of the levels of production that we have now, they have not been able to be harnessed effectively or, in a profitable way, at least in Latam. And about the microplastics in microorganisms, during my presentation, I mentioned just some of them, but of course, you are, healthcare professionals, so many of you are the ones that have written the papers that we use in our negotiations about this. And among the evidence that we currently have are the inflammatory effects of microplastics whenever it is in the human body. And recently, they have identified correlation between the presence of microplastics in the brain and in the brain cells and the cells that are associated to Alzheimer's, for instance. They have identified some correlations of microplastics in the heart with some heart diseases. So, the effects are multiple and varied. And microplastics also bring along many of the chemicals of concern that Nady, Olga, and Andreas mentioned, that, they have like potential cancer generating effects, etc. And then about the last question about pollution that is not by plastic but by other elements, of course, we don't want to replace one problem by another, right? So we just want to have structural changes in the ways in which we produce and consume to mitigate many of these impacts. But I just want to give our ideas during the negotiations where they say that plastic has less climate impact like a glass or cans or tins, but this is not true. Many of these arguments are not true, because when they do these comparisons, they don't take into account that plastic comes from fossil fuels. And there's recent studies that are showing that there's such huge effect of plastics and fossil fuels. Same thing happens with the chemicals. The plastic is a material that, just as we produce it today and as we use it today, it's not safe and it's highly toxic. And we need to take that into account when we compare this to other materials. And that's it. Thank you very much. Okay, excellent. Many answers. Thank you, Daniela. Nady, you have the floor.
Pues totalmente en coordinación con lo que ya dijo Daniela, agradeciendo la reflexión.
So I think Daniela has answered a lot. I have been talking about this for many years, and I always talk about three main topics, or in general, one.
Muy grave y el escenario es muy caótico. Sin embargo, esta no es una invitación a la depresión. Pasar de la
But we,
depresión
of course,
plástica.
we cannot go through all these types of depression, right? Climate depression and then plastic depression. But I think we need to just have this as a reminder. We need to be reminded that we can do things differently, to unlearn and to relearn new models, because the reality is that all of the global economy has been, based on this, and they will only be able to exist if it is completely transformed. Any economy. And it is true that the smaller economies and the smaller companies will definitely have more challenges. And, it will, they will be able to learn to do things in a less harmful way. And it's simple with the droughts that we have
Es muy simple.
now,
Conforme más
as there's more diseases with the, extreme heat waves and rainfall, etc., there's more risks for health.
Entonces, esto es un tema
And so this is something where, this is not in the future. What we can do is to either, insert ourselves in this race or just lose the race. And so, of course, there's issues of justice and access and progress and poverty that we need to deal with, human rights. That is completely understandable. But to be a society that is, stable in terms of climate and respectful of the earth where we live and in equilibrium with the species that we live with, that is the only way of existing. And it should not be a luxury. It should not have to be an option only for some, only for those who have the possibility of doing this. So, well, definitely how to join the network, global network. Well, I have my colleagues here from Salud Sin Daño. Claudia can say exactly, the steps to join the network. The LATAM network is big, 70% of all of the members of the global network come from Latin America. And so it's, it's something that I am proud of as a Latin American person, because we're leading this process. There is a lot of knowledge that is produced in the South, in the global South, and a lot of knowledge that we can continue generating as a global network. So I'll just stop here, and, without answering each question, but I think I have given a, reflection. I agree with what Daniela, and so I will just, for 2 seconds, I want Claudia to speak, to talk about the global network. Okay, Claudia, go ahead. Thank you, Nady. Thank you, Berta. Very, very quick. In the chat box, I just dropped the URL so that you can get to know the different steps and requirements to join the global network of hospitals that are green and healthy. It is free of charge, and this is for health establishments and health systems. You only have to fill out a registration form, and then you can see all the steps. Thank you. Okay, thank you. So we continue with this Q&A. Now I would like to share with Olga and Andreas, and of course to everyone who have been here before, one congratulation message that we got. Congratulations for the presentations. Thank you for sharing your knowledge, and thank you for a call to action to raise awareness about the effect of plastic on health. And also for the call to action to have more scientific evidence and research. And then I would also like to ask 2 additional questions that were addressed to you, Olga and Andres, if possible, to incorporate this or to think about the answers. They're asking if they, they have found microplastics in breast milk, if there is any evidence of this. And then there's also another question, those workers that provide services to prepare plastic products, employees working in these factories, and they are continuously in contact with these chemicals. Are there any protection measures that could be applied? Just please a very quick idea of what is happening with the employees of the factories that are in constant contact with these products and chemical elements. Thank you very much, and please go ahead with your answers.
Thank you very much for the questions. I'm really sorry. Could you repeat the first question, because my connection was not stable and I just missed part of it. The first question out of 2.
Sí. Olga, sé que esta pregunta le va a
so
interesar.
I know that this question is going to be interesting to you because I know that you worked a lot on the gender perspective. So the question is if there is any evidence that have been found about microplastics in breast milk.
Okay, so probably it's a bit difficult for me like to answer right now, but microplastic was found in all human, in human body and in all environmental media. And as Daniela mentioned in the morning, in testicles, that was the most recent information that was presented. So breast milk, yes. Placenta, yes. So there are evidences and scientific evidences on this. I heard, I mean, the previous questions that you asked us was, one of them was about other, if I'm not mistaken, other toxic chemicals in other products, products that are not plastics, right? So just one of the questions. And I should say that, of course, we cannot say that only plastic causes problems and that other products are harmless. We are not saying that. But what we are saying is that plastic contains a huge number of toxic chemicals. And this number is really like, I'm afraid that this is only like a tiny information that we have. This 4,200, 3,200 known hazardous chemicals in plastics. And this is a huge concern. And in addition to all this, we produce plastics that are not actually needed. These so-called like single-use plastics that are produced in huge volumes for just single use. You use it, you throw it away. And I think that yesterday or the day before yesterday, there was a report prepared by Planet Tracker saying that only 91% of plastic is not recycled. It means that we produce a lot and it ended up as waste. And single-use plastic contributes to that enormously. And single-use plastic, it's in medical care. It's not only medical care. It's just, if you search your house, I'm pretty sure that you will find a lot of single-use plastic that you can live without. And Daniel Ellis raised this issue of how much plastic we produce, and that plastic treaty does not say that we want to stop the production of plastic. We are not saying that. But what we are saying is that we really want to stop the production of unnecessary single-use plastic. This is what we definitely want. And this is the first thing. The second thing is about whether we can like focus plastic treaty on recycling. Say, this is the waste treaty. Let's focus on recycling. The example that I gave from the waste, from the Planet Tracker report shows that plastic treaty cannot be like waste treaty only, because we cannot safely recycle products that we do not know what they consist of. This is the first thing. We do not have a technology for safely recycling products that contain hazardous chemicals. And plastic does contain toxic chemicals, which are released into the environment, into our bodies, like under normal conditions. Under normal conditions, you do not need necessarily to heat it. You know, toxic chemicals are released from plastic under normal condition. And of course, if you keep your water bottle under the sun, toxic chemicals will be in your water. You keep these plastic containers in your car. The car is heating from outside. Chemicals will be in your water bottle or in the food that you store in a plastic food container. This is pretty actually concerning. And that is why, for example, some countries right now start thinking how to ban particular class of chemicals in, for example, food plastic containers or food containers or made of plastic. And they are talking about, for example, phthalates, they're talking about bisphenols, they're talking about PFAS chemicals as class chemicals. This is very important, that we need to start talking about plastic chemicals as the groups, as the class of chemicals, not as individual chemicals, but as class of chemicals. For example, for PFAS chemicals, there are about 16,000 PFAS chemicals. How can we regulate each and every chemical? How much time will it take to regulate or to ban one PFAS chemical another? Of course, it's like ages will pass, right? And we don't want it. So the plastic treaty definitely needs to focus on hazardous chemicals, trying to regulate these chemicals as a class, right? So to remove, to contribute to removing these chemicals from the plastic life cycle, right? So, and now I will give the floor to Andres. Please continue.
Okay, thank you, Olga. I think you said most of the important things. I can add that many of the plastic chemicals are not chemically bound to the plastic matrix. The matrix that makes up plastics is polymers. And many of these so-called additives, they lie physically in between the polymers. They are not bound to the polymers. So they very easily migrate out of the polymers, which is why we find them, for example, like Olga said, in water in a plastic bottle, or we can find them in food. And if we go back to your first question, which was, as I understood it, about microplastics in breast milk, you have the same issue there, of course. If you have small particles that contain hazardous chemicals in breast milk, it will contaminate breast milk. And the smaller the particles are, the larger their surface area in comparison to the volume. So per time unit, small particles theoretically release even more chemicals than larger particles. So of course, it's a big concern when we find microplastics in breast milk or in other vital parts of the body, like the brain or testicles, for example. Thank you.
Yeah, so just if I may, I would like to quickly return back to the question about workers very quickly, just saying that, of course, they are extremely impacted. And if we are talking, for example, about textiles, textiles is actually synthetic textiles is probably number one, a sector that releases microplastic, right? And then we talk about tires, of course, and personal care products. But synthetic plastic made of synthetic textiles made of plastic, they release microplastic a lot. And microplastic also contains the same toxic chemicals, you know? And of course, for example, women who largely work in the textile sector, they are substantially affected. They are very seriously affected by chemicals in synthetic fiber that they work with. And there are just numerous publications confirming huge health problems of women workers in textile sectors, including reproductive disorders, including different kinds of cancers and all this kind of irreversible illnesses, and also miscarriages and all these kind of things. And this is largely a result of working with this synthetic fiber made of plastic. We need, like, very clearly understand that fabric that we wear made of, for example, polyester or other synthetic fiber is actually, we wear plastic. It means that we have all these toxic chemicals in this plastic, like very close to our bodies, and that impact our health. But the workers definitely are affected the most, and women as well. And the same with, not the same, but the waste pickers are also like a vulnerable group, but they are, thanks God, so they are quite vocal at the plastic treaty negotiations, and other civil society organizations support them as much as they can, give them the space to speak, like just do whatever we can so that their voices are really well heard at the negotiations of the plastic treaty because they are like the frontline communities. They deal with waste, plastic waste. And unfortunately, as all of us, we do not know what chemicals they deal with, you know? So it's a very serious situation with workers and plastic in various sectors linked to plastic production. Okay.
Can I also add just a few words? So it's not just a problem. Yeah, thank you. So it's not just a problem with microplastics in the occupational environment. You also have, of course, the processing chemicals, and many of the plastic chemicals are volatile, which means that they evaporate from the plastics. And this is a continuous process. Of course, in the occupational environment, these exposures are more concentrated because they work with large quantities of plastic materials, for example, in the form of synthetic fibers in the textile industry. But even in our homes, we actually inhale evaporated plastic chemicals. There are many studies in home environments where they have, for example, checked chemicals in household dust. And you find a lot of plastic chemicals like softeners from plastics. You find them bound to household dust. And these are chemicals that continuously evaporate from plastic materials in our homes. So we either inhale them directly or we inhale them together with dust particles, and then they are transferred into your body. So yes, there is a big occupational problem with exposure to plastic chemicals and processing chemicals, but these problems also continue in our homes, although at a smaller scale, because we have the same plastic materials with the same volatile chemicals in our homes in different items that we use in our everyday life. Thank you.
Muchas
have like
gracias
Thank you very much.
por las excelentes
Thank you
respuestas.
for the
Ha
excellent
sido muy
answers. This dialogue has been quite
Agradecemos también las
enriching and
preguntas
very, very good.
realizadas.
Thank you also
Valoramos
for the
mucho la
questions. We
participación de
value
todos, el interés
the
para
participation
observar
and the
este
interest of
ciclo,
everyone. Now, to
espacio de
close
preguntas y
of these
respuestas, les pido,
Q&A,
por
I would
favor,
like
a
to
cada uno de
request to
ustedes
each
nos
one of
dejen
you
un
to
mensaje
give us
final.
one final
¿Sí?
message,
En un minuto
one
que
final message,
dediquen
1
el
minute
mensaje
each,
que
please.
quieren dejarle a
We're
todas las personas que
quite
están
out of
viendo
time, but 1
este
minute
momento
each
webinar
to
y que lo
give
van
your
a ver
final
luego
key
porque se queda
message.
grabado.
And this webinar is recorded, so everybody can then
Daniela
look at it
se
later.
excusó,
Daniela
por
excused
favor.
herself because she had to leave, but please, you start with Nady. Well, less than a minute. Just want to thank you for your time and your interest. Thank you, everybody who joined and who asked the questions. And then, this is, of course, this is just one piece of a big puzzle that we need to do as humans, as professionals. So I think we each have to do what we know to do best. And I really hope that I have represented in the negotiations the different professionals, that are actually working hard on this. So thank you very much and have a nice day. Thank you, dear Nady. Olga, go ahead, please.
Yeah, I wanted to repeat actually what Nady said. So first of all, thank you so much. We really appreciate this opportunity. And I think that the more we talk about transparency of chemicals in plastics and the information in individual plastic materials and products, the more we understand the issue ourselves, the more we try to explain this to everyone who is interested, to show that this is actually the basis to address plastic problems. Because how can we address a problem if we do not know? But if we do know, then the solution will appear, and we need to stay positive and think progressively about how to resolve it, but starting with ensuring transparency and traceability of chemical information in plastics. So thank you so much.
Muchas gracias, querida
Thank you
Olga.
very much, dear Olga. Please go ahead. The floor is yours, Andreas, and your final message.
Thank you very much. So I would just to I would like to go back to one of the questions, whether other materials are toxic or not. Of course, all kinds of materials and products potentially may contain toxic chemicals, which is why the concept of transparency and traceability is relevant to all kinds of manufactured materials and articles. It's not just plastics, but the plastic treaty is an opportunity to actually put in place globally harmonized approach on how we deal with transparency and traceability for chemicals. And if we get this in place in the plastic treaty, it will set the bar high for how we think with other multilateral agreements and with national legislation. So it's a much bigger issue than just plastics. Transparency and traceability is necessary for all kinds of manufactured materials and products. Muchas gracias.
Magníficos mensajes
Well,
finales.
Excellent final messages. Thank you very much again for your incredible presentations. Thank you, Daniela Duran. Thank you, Navy Cruz. Thank you, Olga Speranskaya. And thank you, Andreas Prevotny. Thank you to everyone who participated, who are joined online, and who are part of this and promote regional integration. And thank you to the Orasconu team. Again, I would like to thank you on behalf of Dr. María del Carmen Calle Dávila, Executive Secretary of the Orasconu. Our whole team here at Orasconu, we would like to thank you. We would like to invite you kindly to webinar on June 25th that is going to be devoted to child labor and street children. That is something that is very relevant also, and remind you all that on Thursdays at 11 a.m. Peru time, we have these webinars and, to talk about an important topic to promote continuous learning and constant learning. Thank you very much and have a good rest of your day or evening.